Live webinar about understanding your insurance through your fertility journey. I am Shannon Taylor. I am the insurance administrator here at RPSD, and I have been working with RPSD as the insurance administrator for 13 years. I'm excited to be able to join you today and share some of the knowledge that we've acquired over these past few years to help you have a more enjoyable journey through your fertility treatment as much as possible. Today, I am also joined with our lead billing assistant, and her name is Coco, and I'm going to give her the time to give us a brief introduction of who she is, and she'll be our moderator today. So, Coco, please let us know who you are.
Thank you, Shannon. I'm Coco, and yes, I handle the insurance billing aspect. So I work directly with your insurances, and I especially take care of the denials that come in. And we want to make sure that, whatever Shannon has verified, we execute with the insurance. So that's what I do here at Reproductive Partners, and I am coming up on 3 years with the practice. I'll take it back to you, Shannon. I guess we can just jump into these topics that we have set from most commonly asked questions from the patient. So I guess the first question I will ask is, what tips do you have to maximize insurance benefits for fertility treatments?
Some of the tips to start out with, I would recommend, is getting to know and understand the benefit on your plan. Everyone has access to what's called a benefit plan summary or a summary plan document, something of that nature that's going to give you all of the details of the benefit that's available for you to use. If you don't have access to that right now, your HR group should be able to provide you one or get you in touch with a link or some sort of document to be able to provide you with that. I also could recommend that you talk with your insurance company through member services and ask them about that. Occasionally, they can bring up that benefit summary and help read it to you and be able to help give you that to understand what you're needing to proceed and know what you have.
Okay. And what does that mean in terms of if I want to use my insurance for medications?
Well, it'll depend on the benefit that is available through infertility. Some of the infertility benefit that's available will include the medication that you need for your treatment. Some of it won't include the medication, and that could be that it's not going to come from the infertility benefit that's set aside to cover those services. It might have the benefit available under your major medical benefit or through your pharmaceutical benefit. So that's another thing that we would be able to verify. Where is the coverage for medication going to come from? Is it the same as the treatment or is it separate? And that also would be able to be specified in that benefit summary of where the medication is going to be covered from.
Okay. And what about gender neutral billing?
Gender neutral billing, we have had a small snippet of this that we've been able to share on our social media page with RPSD, but to help bring it back to everyone's forethoughts, the gender neutral billing is essentially allowing us to be able to bill services for fertility treatments under either partner, be that a male partner or a female partner. So when you do have an infertility benefit available to you, there, and you have your partner on the plan, if there is a lifetime maximum that's considered a dollar amount, that extends to both partners on the plan. So we could say that there would be a $25,000 lifetime maximum for infertility treatment, but that would be for the female undergoing the egg retrieval and her partner that's on the plan. Her partner would also get $25,000 to use towards infertility treatment, and that would be able to be credited towards services that are considered gender neutral, which would be after we've been able to collect the egg and the sperm and create an embryo in the lab. So all of the embryology services that take place to help culture and develop that embryo are able to be billed under either partner. So instead of having to drain the lifetime maximum quickly under the female undergoing the egg retrieval, we're essentially able to divide the costs between her and her partner.
Okay. Let's talk about the different terminology that patients might have questions about when they receive their statements, especially.
Right.
What's the difference between a copay, a deductible, coinsurance?
Yeah, the very basics of insurance, but they're very important to know when you're proceeding with any kind of medical treatment because they'll apply anywhere, particularly at Reproductive Partners. The copay is the amount that you would be responsible to pay anytime you come in and visit the doctor in the office. That can vary between $20 or $30, and it would be applicable to what your benefit would show as a specialist copay because infertility treatment is considered a specialty. A deductible is the amount that you as the patient are required to pay and to meet before they would be able to offer any kind of payment from the insurance company. So we also verify that amount when we verify your benefit to see how much you need to pay upfront out of pocket for any services before any portion of that is covered by your insurance. Once that deductible has been satisfied, say you have a $500 deductible and you've paid the $500, then something that comes in that will allow you to be able to have your insurance pay for portions of your treatment is called the co-insurance. There is the percentage that's attached to what you see generally on your benefit card or in your statement that there's a co-insurance that your insurance will pay, and that will vary depending on the policy that you've chosen. It could be 90% co-insurance after the deductibles met. It could be 100% in co-insurance after the deductibles met. What that's going to allow for you is once you've met that deductible, any services that are completed from that point on throughout the remainder of the calendar year will be covered 90% by your insurance, thereby leaving 10% as patient responsibility. Or if it's an 80% co-insurance, it would be 20% responsibility towards the patient. And as you proceed throughout the rest of your treatment or any other medical treatment that you're completing that year, once you've reached what's called the out-of-pocket maximum, that is exactly what it says. The amount that you will pay the most before your insurance covers everything at 100%.
Okay. And I guess once the out-of-pocket max is met, then how does that apply to the lifetime maximum?
Okay, another terminology that's very important to learn if you have an infertility benefit is sometimes the lifetime maximum will be limited on how much your insurance will pay towards your infertility treatment. So previously we talked about having a $25,000 lifetime maximum. So once you've read your deductible and your co-insurance starts to apply, that 90% will say that your insurance is going to start covering will now start to accumulate towards that infertility lifetime maximum, say that $25,000. And as you continue treatment and your co-insurance continues to apply, then as soon as it reaches that full amount that your insurance has paid, say they've paid up to $25,000 for all of your treatment services, after that, your benefit is then exhausted and you wouldn't be able to continue to use insurance to cover your infertility treatment.
Okay. And let's go over the terminology for more on your side of the house, Shannon, like prior authorizations, pre-certification, those kinds of terminology.
Yes, most often when you do have an infertility benefit that is available for you to use, the insurance companies require what's called a prior authorization or a pre-certification. Depends on the insurance company and which terminology they choose to use. They both mean the same thing. Essentially, what Reproductive Partners is going to do is submit this prior authorization or a notification to your insurance that you're going to be completing this treatment to be able to help show that you meet the medical criteria to use this benefit. More often than not, they want to be sure that the conditions have been met to be able to offer service coverage for infertility treatment. We at Reproductive Partners have a great system with our front office staff to be able to know exactly when we would need to request a prior authorization for those services for all of our patients. And our front office team works together really well to be able to be sure that we collect that within enough time to be able to know what's going to be covered for this upcoming cycle and what potentially won't be covered for this upcoming cycle. What we like about the pre-certification or the prior authorization process is it's essentially a final determination of knowing exactly what's going to be billable to your insurance and what won't be billable to your insurance. So you'll know upfront before you begin your treatment what you have to pay for out of pocket instead of getting it on the back end and possibly getting a surprise bill that you had no idea that you would be needing to pay.
And is this a guarantee of coverage?
Unfortunately, it's not. There have been many times that we have received prior authorization from the insurance company that has granted them approval. They've met the criteria, they've known what's going to be billable or not, and we submit it to the insurance, and there's times they come back and deny it. But that's why we have Coco. She is remarkable at making sure that we take all of the documentation that we have on your behalf, and she will fight with the insurance and appeal to the last possible moment to be sure that we can get that coverage for you that they've stated that is something that should have been billable and payable. There's been a handful of times that that hasn't been successful. However, we've been able to arm the patient with what they've needed, and I have seen the patients continue to advocate for themselves, and they've been able to help them get those claims covered and paid when they should have been in the first place. But there's always a lot of logistics that are considered when you're going through the claims process, and it's not foolproof, but that's why you have the whole team here at Reproductive Partners and the administrative staff and the billing team to help you navigate through that if it comes to it.
Absolutely. Let's discuss what is the difference between infertility treatment versus diagnostics.
Yes, there can be in the state of California a difference in infertility coverage because California is a partial mandated state for infertility services. That means the employer group is not required to offer infertility treatment to its employees, but they can offer certain smaller services. Most of what we see is considered diagnostic and treatment of the underlying condition.
Uh-oh, I think we lost Shannon. Let's see. She comes. Here we go. I think we're back live.
That's right. There we go. We're back. Apologize.
There you are.
Yes, I apologize for the technical difficulties. This is what happens when you have live everything that goes live. Well, fortunately, we're back. Let me explain a little bit about the difference between diagnostic treatment of the underlying condition and infertility treatment. When you have diagnostic services, that's essentially the starting point. You get to come to the specialist office, have a consult with the physician to help determine why you possibly are not able to achieve pregnancy for however long you've been trying to conceive. It also will extend to any sort of diagnostic services to help us understand why that you're not able to get pregnant. There are a lot of reasons why couples are unable to conceive, and it would extend to things of blood work that we could manage through there. That would extend to potential diagnostic and exploratory surgery, like perhaps under a ultrasound in the office, the physician notices that you have polyps inside your uterus, and that would require surgical removal, and that would be covered under your diagnostic treatment with your insurance. Once you've been able to determine your infertility diagnosis, then that's when the coverage for diagnostic and treatment of the underlying condition would cease. Once you know what your diagnosis is and you need to continue to achieve pregnancy through fertility treatment, then you have to be sure you have infertility treatment on your benefit.
Okay. I think we've got everything down in terms of terminology. Let's review the different insurances we accept at Reproductive Partners.
There are so many insurance companies out there.
Mm-hmm.
The majority of the insurance companies that Reproductive Partners Fertility Center is in network with or contracted with include United Healthcare, Cigna, Aetna, Anthem Blue Cross, or any services that are through Blue Cross, as well as HealthNet. And we have a small contract with the VA for those members who have had met the criteria to complete IVF. I think that's all of them. That is part of our verification process, though, to be sure that we're in network with your plan.
We do take Meritain as well. Yes, and Progeny, a little supplemental.
Progeny, yes. I'm so glad that you mentioned that one. That one has become a very popular benefit to use for infertility treatment this year.
Yes. Let's see. What insurance plans include fertility coverage?
Now, this one varies. You can't just pick and choose, right? So you say, okay, they're in network or contracted with all of these plans. The way, as I said before, that it operates in the state of California is employer groups are not required to select an infertility benefit. So most of how you're able to achieve the ability to have an infertility benefit on your plan is if it's offered through your employer group. Most often self-funded plans are not extended the ability to have infertility benefit coverage. I most often see that they have to be a large group, employer group, to be able to have that infertility benefit. So to answer that question straightforward, most often it's going to determine who your employer group is and if they're able to offer that infertility coverage for its employees. And their HR department would be able to tell you ahead of time if that's something that they would offer for coverage or not.
Okay. And if infertility is separate from like diagnostics, so before a diagnosis is determined, would the diagnostic tests and initial consultations be covered by insurance?
Again, that mostly depends. If you have that small portion on your plan that's considered diagnostic and treatment of the underlying condition. And that is usually very easy to determine one way or the other. And you as the patient can also call member services and ask them, can I go to the doctor and find out what's wrong? And they should be able to look that up for you as well. So if you're wanting to know that before you even come into schedule, you are always welcome to do that. Member services is there to help you navigate through what you may or may not have covered. And initially at the beginning, that includes that consult with the physician and anything to help determine why you can't get pregnant. But on the other side of it, if you do have an infertility benefit, it could be divided into two different categories. We could have infertility treatment, but that's essentially looking at lesser treatment before greater treatment. And what that lesser treatment would include is something simple with ovulation induction, needing to use some medication to help stimulate ovulation. That can also be done with or without artificial insemination or intrauterine insemination. And those services are typically considered lesser treatment. And they'll typically fall under that category of infertility treatment. The other category that it will extend to is that greater treatment, which is typically labeled as advanced reproductive technology. And that includes what we already know, in vitro fertilization or IVF, and the subsequent embryo transfers that would follow. And that is something else that would be considered that greater treatment that would be specified that you have in vitro fertilization treatment. A lot of times patients come in really excited that they have infertility treatment, but they're not able to understand that there's a difference between just diagnostic treatment for the underlying condition, or that it's just that lesser treatment that they have for the simple intrauterine insemination, and it doesn't extend to IVF. And so it's helpful for us to be able to provide that as a courtesy to them so they know exactly what they have to work with moving forward.
Okay. And once I undergo, or a patient undergoes that initial consultation, what are the prerequisites that are needed to continue with fertility coverage for treatment?
Yeah, that one is really difficult. There's different insurance companies will require different criteria to be met before you're allowed to move on to certain treatments. So they're Aetna, for example. They have a very strict clinical policy. And most often the plans are subject to those criteria guidelines, where some patients, if they're under the age of 38, will be required to have tried 3 IUIs before they're allowed to move on to in vitro fertilization. There are exceptions, say they have their partner has severe male factor, or they have both of their fallopian tubes are blocked. So an IUI would not be very beneficial in treatment terms. And those are the cases that they do review on a case-by-case basis during this prior authorization process. What we like to know ahead of time is to be able to let you know if there are certain prerequisites that you need to meet before you're able to move on to different treatment or services. And the knowledge that I've had and been able to acquire these past 13 years helps me become very familiar with each of the clinical policies between all of the contracted insurances that we have to help you know what you need to do beforehand. So hopefully it's not a surprise at the end and you have to stop treatment and go on to something else, or realize that you don't have coverage for something. We really want to avoid that if at all possible.
Right. Okay. What if my partner has benefits, but I don't?
Mm-hmm.
Can I potentially use their benefits?
I can understand why this question would be asked, because you need both partners to be able to have infertility treatment be successful. The unfortunate thing is, unless the person is on the policy, they're not allowed to use any kind of treatment services to be billed under that patient. So, for example, let's say we have a male patient come into the office with his female partner, and they would like to try to get pregnant with infertility treatment. He may have an infertility benefit available through his insurance, but his female partner may not. The unfortunate thing is, a majority of the services that need to take place have to be done under the female patient that would be undergoing the egg retrieval. And unfortunately, we're not able to bill any services that would fall under a patient that's not on a policy to the insurance. And we also can't bill those services under the partner because they actually are considered female only procedures. I'm sure if we were to submit that to claims and had an egg retrieval under a male patient, most of the time in the claims process that would get kicked back and say, no, you can't do that. So
Right.
unfortunately, both partners would either need to have their own separate policy that includes infertility treatment, or be on the same policy that uses the same infertility benefit.
Okay. The next question is, what documentation and paperwork are required for insurance prior authorizations?
This is a big one. And this is a lot of where the patients come in to provide a lot of help. I am going to be able to submit those prior authorizations to the insurance company. However, I need to be able to show that you, as the patient, have met the medical criteria. And to do that, we send in the supporting documentation to help establish medical necessity. Sometimes, if we don't have all the information from patients, if we haven't been able to have them collect all of their records from previous treatment or other offices, we don't have all of it with us, and we can only send in what we have. So I will provide the clinical documentation that's available to me at the time that the prior authorization is submitted. But if I don't have all of it, sometimes certain services can get denied. I'll give you a quick example. We had a patient that needed to do a service that's called pre-implantation genetic screening of her embryos. And we submitted that authorization in with just the clinical information that the patient had provided to us. But unfortunately, that information was not enough to show that it was medically necessary, and the insurance denied it. And the patient was actually very upset. Rightly so, because she did think that she qualified for coverage, which in fact she did. However, she had neglected to include the medical records from her previous physician's office that showed that she met that criteria. And so after discussing further with her, she provided that clinical information to us. We were able to resubmit for reconsideration, and she did meet the criteria and was able to make that a billable service. So it's important to be sure that you include all of your clinical records at the beginning of your new patient consult, or even through the middle of treatment. We'll take it anytime you have it, but it does benefit you in the long run to be able to allow us to get services approved upfront and the first time.
Okay, I think that wraps up most of our questions about insurance coverage. Do you want to sum it up and, I guess, revisit those bullet points?
Yes. So all in all, the best thing to do is to check with your member services through your insurance company to verify if you have an infertility benefit available. Also, check with your employer group to determine if there is infertility coverage that they offer, and potentially being able to include that on their policy as you progress through their treatment. The other thing is to become very familiar with the terminology that's out there, to know what your copay is ahead of time, to know what your deductible is, so that there's no surprises later. We love working hand in hand with you on those things, and it helps you if you're already prepared as you come in with a little bit better understanding of how your insurance works. And when you do able to determine that you have an infertility benefit, if you ever have questions on what it means, because infertility services and the jargon that's written by the insurance companies in those benefit summaries can kind of be complex and a little difficult to understand, we are always happy to go through them with you. We have financial counselors that are dedicated to helping you understand how that would work and apply to the certain treatment that you're going to be completed at the office. I'm available as well to help with any of those services and asking those questions to be able to help you have a better understanding of how it would be applicable. And we are going to make sure that we take the time to help you use your benefit to its full potential. If that includes allowing you to use gender neutral billing, sometimes we can counsel the patients to use medication at certain pharmacies that cost less. Sometimes we counsel you to actually pay for those services out of pocket. Sometimes what we see is medications can draw a large chunk from your infertility lifetime maximum, and it actually will cost the patient less if they pay cash for medication. So we look at your benefit that way to help determine what is the best course through being able to pay for your medication. But the end of the day, we really just want to make sure that you understand financially how your insurance is going to help you in this treatment, so that it's one less thing that you have to worry about as you're coming in and completing this treatment. We know it's difficult. It's difficult to even call and make that first appointment to come in and recognize that you're going to need some help. And I think our patients are very brave to call and come in and talk to people and help get that assistance that they need to move forward. And we're happy to be able to provide that assistance so that they can leave the office every day feeling calm and comforted and confident that they're going to be able to get through this.
Do we have any personal success stories or experiences from patients navigating insurance coverage?
Yeah, one of them I did share with you when she provided that extra information, that
Right.
she was able to get the coverage for the biopsy of her embryo because she was able to show that she met medical necessity. I do have a patient that I worked with closely, that was coming to us for fertility preservation due to a cancer diagnosis. That is a very difficult place to be in, and you don't have nearly as much time to decide and figure out what kind of coverage you're going to have for that type of treatment. But working hand in hand with her and her mother, we were able to talk to the insurance companies actually together. I remember doing a couple of three-way phone calls between myself and the insurance company and this family to help them navigate the system, to understand that what they were looking for, and to be sure that the agent on the other side of the phone understood what they needed. And they were able to make that understood. And as we navigated through, we were able to submit those claims to the billing, or through our billing department. And they were able to get claims paid for and covered because they had taken the time beforehand to talk it out and to work with us to be able and trust us to be able to help them navigate through that. That's one of them I know off the top of my head. I know there's many others.
Yes, yes, absolutely. Um, I guess we'll go over to the Q&A and see if anyone has any additional questions.
Mhm.
I do see one from earlier. The question is, can egg freezing be considered tax deductible?
This is a good question, seeing as how we're in tax season right now. as
Right?
as with any medical treatment that you complete, you can have it become tax deductible. You would need to be sure that you check on a lot of other things, because any services that you do through your dentist's office, through another physician, any kind of medical treatment or anything that you pay out of pocket can be something that you can accumulate towards your tax deduction. So it does fall under the medical services as a tax deduction. But I'll leave it at that, and you'll need to talk to your tax expert about how to be able to make sure that that can become a tax credit. That's a little out of my scope, but I do know you can use it, just like any other medical expense.
I don't think I see any other questions in the chat box right
Oh,
now.
I answered a lot of them for you. That's great. I'm sure many of them will come up with other questions. I usually think of other
Yeah.
questions afterwards too. Well, thank you,
Yeah, we
Coco.
covered a lot.
Yeah. Is there
Thank
anything
you.
on this side after our discussion today, and having that perspective from the billing standpoint? Would there be anything that you could recommend from the back end as you see claims go through that you could provide to our patients today to give them a little bit more on their financial journey?
I mean, we did cover, certain scenarios where we do obtain a prior authorization and we do have confirmation from insurance that yes, they are medically approved to undergo these services. And then in the back end, we do get, denials. And um, on my end, I do appeal these claims with the documentation that Shannon was provided and any medical records that would support coverage. And in some cases, they do, fall through, and insurances do uphold these reconsiderations or appeals. And in those cases, we would need the patient's help to help advocate because for whatever reason, it appears that members in terms of the patients, but from the insurance standpoints, the patients are members, right? So members do have more leverage than we do as providers, believe it or not. So
They really do. They really do.
yeah.
I can tell you there's times that I have called on behalf of the patient several times, but the minute I involve the member or the patient and bring them on the line, it is almost a full 180, and they are very quick to respond to make sure that they keep their clients happy. So yes, recognize that you as the patient and the member of the insurance policy have a lot more power than you think. And we're happy to help bring that out for you to advocate for yourself and be in your corner to help you out through this process. That's a really good point. I'm glad that you
Yes.
said that, Coco.
Yes. Yes, it's very helpful.
Excellent. Well, if you have enjoyed our webinar today and you have had a better understanding of how you can navigate through your infertility journey using your infertility benefits and your insurance, we would love to have you come in and talk to us. If you want to schedule an appointment with Reproductive Partners Fertility Center, you are welcome to schedule at fertilityclinicsandiego.com, or you can call us directly at 858-552-9177, and you can speak with our new patient care coordinator. We'll be able to schedule you with one of our many physicians that are always ready to help any of our patients be able to be successful in achieving pregnancy. And as always, we're here as the front office staff with the amazing support of our clinical team and our laboratory team to help make sure that your whole entire infertility journey is a success. So with that, we're happy that you joined us today. Thank you so much. And if there's ever any other questions, you know where to find us. Thank you all. Thank you so much,
Thank
Coco,
you.
for your time today. I really
Thank you,
appreciate that.
Shannon.
All right.
Absolutely.
All right.
Take
Take
care.
care. Bye-bye.
Bye.
I can't.